And welcome in again to the Dave LewAllen podcast. We cover sports stories, newsmakers, and difference makers in our community. And today we're talking community with Honor Community Health. And the CEO, Deb Brinson, is here, along with the Chief Medical Officer, Dr. Nikhil Hemady. Thank you both for coming in today for this conversation. And Deborah, let's begin with you. Honor Community Health. Tell me about the organization and who is it you serve?
Great. Well, first, Dave, thanks a million for having us be a part of this podcast. And we're always really excited to talk about Honor Community Health. It is a community health center that serves Oakland County, the residents of Oakland County. But we're specifically working to make sure that individuals who don't have access to health care on a routine basis, that they know that they can come into Honor Community Health and receive primary care services, coming in to see a physician or nurse practitioner, prenatal care services, mental health services. We have a dental clinic. We see individuals coming in for dental services. We have 21 sites, believe it or not, throughout Oakland County. I kind of say we're the best kept secret in Oakland County because we partner with different groups and we actually locate within those organizations. So we have 11 school-based health centers throughout Pontiac. Here in Waterford, we have school-based health centers. In Avondale, we do. We have a dental location within Pontiac area.
Now, as part of this, you have also made a recent purchase of a former charter school that is part of your growing health footprint.
Correct. Yes. So we're really excited. As you shared, Dave, we have purchased the former charter school, which is now our location that will be developed so that we can see more patients. But as of today, we're really excited that at the address of 96 Cass Avenue, you can come in for care 7 days a week from 12 until 7 p.m. And a physician is there, a clinician is there to see your health care, your physical needs. We also have mental health persons there, individuals who need support services, who just need somebody to talk to. It's a great community partnership. It's consists of working with the health department, the Oakland County Health Department, working with community mental health, but we're also working with OSHA that helps individuals who need support services, like with access to services through Medicaid, needs assistance with Medicaid enrollment, or weatherization, or access to food. It is really a unique opportunity where you can get services under one roof by multiple agencies.
And Dr. Hemady, you've made a decision personally and professionally to work in the community health space. Why has that been important to you? Why this path for you in terms of providing medical care for individuals and families?
Yeah. First of all, thanks, Dave, for having us on your show. We're very excited to share our journey here at Honor Community Health. So I've been in this community, in the Pontiac community, for nearly 29 years, including I trained as a family physician in this community. And the community has given me a lot. So this was a way to sort of give back to the community. Initially, I thought I would stay here for just a few years, but those few years turned into 1 decade and 2 decades, and now close to 3 decades. But I get to work with some amazing people at Honor. But I think what is the biggest attraction to me is the community itself, the patients who are so appreciative and so grateful for the care that they receive from us. There's a lot of work that goes into being a physician and practicing in this community. Trust is very important. I think trust doesn't develop overnight. Trust develops over a period of years. It sometimes takes decades to develop with our patients. It's about educating our patients. That's what I enjoy about my job as well. And we'll share very soon with you is what we've done in terms of ensuring that we have a steady pipeline of physicians that will be going out into their community, whether it be here in Michigan or whether it be anywhere else in the United States. We're training family physicians. We've taken on that venture as well. We're now opened up a brand new family medicine residency program here in the community where we're training family docs to become trained in primary care. So very excited about that as well.
And the importance for serving in a community, an underserved, maybe underprivileged community, to make sure that the population can stay healthy, can learn more about taking care of themselves. I mean, it seems like it's a critical need, and I mean, it's important for all of us.
Absolutely. So as a primary care operation, as a primary care physician, as a primary care clinician, we offer the entire spectrum of services, everything from caring for a newborn, well child checks, vaccinations, immunizations, caring for moms who are pregnant, making sure that they deliver in a safe environment, and then making sure that those babies that we deliver come back to the clinic, offering them other services that are centered around the dyad or the triad, the mom, dad, and the baby, caring for individuals that live with HIV infections, individuals who have substance use disorders, the elderly, and so on and so forth. So it's really the entire spectrum of primary care that we see in our practices. Just because we serve or care for an underserved population does not mean that we underserve them. You have to make sure that you have you have a team that is dedicated, that is committed, and that provides high quality care. That's the premise of that's sort of like the way we operate.
And you're not new, but as you say, kind of the best kept secret. I mean, and there's been an evolution, right, from the founding back in 2007 of what is now Honor Community Health?
Yes. So in 2011, we formally started delivering care to the residents of Oakland County, but specifically Pontiac. And believe it or not, Dave, we see almost 40,000 unduplicated patients through our network, 100,000 visits each year. And we've steadily grown since 2011, which gets us to the 21 locations that we have throughout the community. We're a nonprofit, so our whole focus is making sure that everybody has access to healthcare, including individuals who are uninsured, including individuals who have Medicaid, including individuals who have Medicare. And so we started out just doing primary care, but as Dr. Hemady said, we're now doing prenatal care, we're now doing HIV care, we're now doing substance abuse care. We're now doing walk-in services for anybody coming in. So since we've moved into the new location, we've had people stop and say, "What are you guys here?" We say we do healthcare, and then they stop and they talk with us about, "Well, can I come here for care?" Yeah. We're like, "Yes, you can come here for care." So,
how big a problem, doctor, is underinsured or not insured, in Oakland County? I mean, many of us look at Oakland County and think it's a very prosperous county, and it is, but it also isn't. So not having insurance, not having the right insurance, I mean, that's for people, I mean, that's potentially life-threatening to not have the care one needs.
I think if you look at Oakland County overall, I think one would probably have the impression that this is a county that doesn't have any healthcare related issues or any of those issues. But if you look at certain areas, such for example Pontiac, certain pockets within other, for example Southfield, etc., there are areas that need healthcare. We talk about something called the Social Vulnerability Index. If you look at the Social Vulnerability Index in a community like Pontiac, which it's about close to 100. If you look at communities that are just south of us, more affluent. For example, if you look at Bloomfield Hills, Birmingham, the social vulnerability index drops to 1. And what that means is that these are communities where as it approaches 100, where there are issues related to transportation, issues related to just getting access to healthcare, other areas that have an impact on health outcomes. Individuals in communities like ours tend to have shorter lifespans compared to individuals in more affluent areas. Health literacy is an issue, access to quality health care, etc. Those are areas that impact health outcomes. Our goal is to improve the health outcomes in the communities that we serve. One of the areas that we are working on is also how do we care for individuals who have underlying mental health illness? How do we address some of their chronic medical issues? How do we prevent them from developing chronic medical issues such as diabetes? Some of these individuals are on chronic medications that put them at higher risk for developing diabetes, high blood pressure, high cholesterol, so on and so forth, which eventually results in them having perhaps lower life expectancy than other individuals who do not have these issues. So our goal is to help identify these early on, or if they're already present, to sort of mitigate those issues.
Well, and you mentioned that began with primary care, but certainly the mission has expanded, and it's a huge mission, it seems to me, providing various services and treatment options. And one thing in underserved communities as well, you mentioned the 19 locations, I think, right? Transportation for many becomes an issue as well, right? To getting to an appointment, getting to a facility to receive primary care or emergency care.
Yes. Transportation is a huge issue. So that is the reason why in many of our locations, we coexist with somebody. We go where patients are on it. We are located on bus transportation lines so that people can easily access us. We're located within Pontiac, the city of Pontiac, so individuals can walk. So transportation is a huge piece of it. Access to healthy food. We have access to fresh vegetables and fruits, but many of our patients don't have access to that. So we partner up with gleaners and make sure that our patients have access to healthy foods on it. Places where they can come and feel safe and walking and exercising. So we do Walk with the Doc every Wednesday morning during the summer at the Wisner Stadium at 7:30 in the morning. And our new location has a gym, so we'll continue to do walking opportunities during the wintertime so that people can, really feel good about what they're doing. Housing is another big issue, that I think at some point we participate in community groups to really address what are we going to do about healthy and safe and affordable housing for individuals in the pockets. That's what I love about Oakland County is that it's a community that cares about each other. And so those of us that have access to other resources that others don't really do come together and really figure out strategies on how to make sure that all of us are living and are doing what we can do to lead the best life that we possibly can. I want to, when Dr. Hemady talks about life expectancy, what is so daunting to me at moments is how we got started. There's a 20-year difference in an individual who has serious and persistent mental illness. They're most likely to die 20 years earlier than somebody who doesn't have mental health issues. And so, we all know people in our lives that have mental illness, serious mental illness. I want them to live long and healthy lives because they are engaged with families that love and care for them. So we've had this mission for 10 years. We are excited to be on that next curve of growing and developing and, excited about those opportunities.
And spreading the word
Yes.
that the services are there and that people should take advantage of the services that are close to them in Oakland County? I mean, that's so important as well.
It is. So we're located, you can go to our website at Honor Community Health Center. It lists all of our locations. It lists all of our hours of operations. But like I said, today is our 360 Care Clinic is opening up, and anybody can walk in for services at that location 7 days a week from 12 until 7 p.m. at night, and we're very excited about that. It's kind of like a no wrong door.
Yeah.
We'll get you hooked up with resources in the community.
And let's talk a little bit about the school-centered facilities as well. I'd mentioned to you, growing up, elementary school, we had a nurse, in the school. That's not the case in many, many schools today, yet Honor Community Health is in a number of schools here in Oakland County. Tell me how that developed and why that's important as part of your overall mission.
Absolutely. So we know that healthy kids are more likely to graduate from high school, which is really, really important. They are more likely to engage in long-term healthy habits, and they're less likely to engage in at-risk behavior. And so when we really looked at the social index, like where did healthcare services need to go to help kids and families? Mm-hmm. We really decided as a community and as an organization is to take healthcare services to where kids are at. So we're in a school that has a school-based health center. That includes, it's kind of like you take a doctor's office and you put it right into the school for that student and their families. So they have access to primary care services, they have access to prevention services, they have access to mental health services. You know, Dave, coming out of COVID or during COVID, what we saw were a number of kids who started experiencing mental health issues. And we really wanted to make sure that kids had access to mental health services. And so all of our school-based health centers have not only primary care clinicians so that they are getting good healthcare services, but they also have behavioral health services, and they work as a team. And so in Oakland County, we have 11 school-based health centers throughout the community where we really go in and we work with the school and the school personnel and families to make sure that kids get access to healthcare services.
And is that something you would look to expand further into more schools as time develops?
We'd love to be able to do that. So as funding becomes available, we often look at where's the next step of what school would we partner with to deliver those services. So we're always looking for opportunities to make sure that our kids come into this world in a healthy way through our prenatal program, but that we continue to support them on that journey of being healthy throughout their lifetime.
That's fantastic and so important. Now, Dr. Hemady, you'd mentioned earlier also, preparing others to become primary care physicians in communities as well. Tell me how that has become part of the mission as well, and who is involved in that program. How does that work? I mean, you're trying to help the next generation of physicians.
Yeah, Dave, this was, we sort of embarked on this journey pre-COVID. It was our mission to establish a family medicine residency program. And the reason for that is multifold, but also because we want primarily twofold. Number one is that we want to ensure that there is a steady pipeline of well-trained family docs, family physicians who stay within the community here in Michigan, just like I did, but also for them to go out into areas that are of need. Secondly, to train them in an environment, in a setting which simulates what real life is, so that they get trained within communities that are underprivileged, underserved, which have limited resources. Because many times when residents come out of training residency programs that are based in hospitals, it's not the same environment as they do what they see here with us. So that's the key difference. Here, you pretty much see anybody who walks in through the door. It could be a pregnant mom who walks in at 36 weeks who has received no prenatal care. It could be a well child that comes in. It could be a ear infection. Or it could be that 90-year-old grandma who comes in because has a sprained ankle. So it really trains you in a community-based setting, and it well prepares you for what real life looks like. And so that was our goal, to embed family docs or future family docs within our communities, to train them, give them real life experiences. Of course, they get the hospital experiences as well. We have very solid partnerships with Trinity Health Oakland, Corewell at Royal Oak, and so on and so forth. But I think the real goal was to ensure that we have a steady stream of these physicians that will stay within our community. Michigan is looking at about a deficit of almost 500 primary care clinicians. And that is going to have a very negative impact on health outcomes for our state. So we're doing our small little part here in making that, bridging that gap.
Well, and there are doctors like yourself who this is the path that they want to go down in order to serve, right?
Absolutely.
And to treat. And so the fact that you can provide this specific opportunity is part of that training. I mean, that's a great thing.
Dave, we became Michigan's first FQHC, Fairly Qualified Health Center, to actually have a residency program. We have the distinct honor to have to be Michigan's first. It was a challenge, but we accepted that challenge. I think working through COVID was not easy because all the hospitals were in COVID mode. And their priorities were aligned, obviously they were patient-centered. So that put a hold on this program for a little while, but we're back on track.
We're excited because we just brought on our last cohort of residents. So we now have 18 young people being trained in community medicine. And Dave, that's huge because the focus is in going into communities and providing primary care. So they're going to be trained in how to work with an individual who's homeless. When you don't receive care and you come in for the first time, you're generally coming in with not just one issue. No. You're generally coming in with 5 issues. Our residents are being trained on how to address those 5 issues all at the same time. So wherever they leave and go, they're going with a great education. And that should be celebrated in Oakland County. Like, we are the first county to be doing community-based medicine within our setting as a federally qualified health center. And we take that very serious. Yeah. So first year, our graduates will be graduating a year from now, and we will be sending them on their way. But most importantly, what we want them to do is we want them to go where primary care docs are needed. And in the state of Michigan, as Dr. Hemady shared, but across the nation, there's a huge shortage coming up of family medicine physicians. That will create problems for hospitals because the hospital emergency rooms will be seeing those individuals coming in because they don't have access to primary care. That's expensive medicine. So we said, what do we do to address that? And we're very excited about taking on this unique initiative and very proud of it. Yeah.
You mentioned that Honor Community Health is a nonprofit. You're federally funded. Given kind of the environment that we're in, is that a concern going forward? Funding, and I know that you've addressed concerns about Medicaid funding going forward as well. Is that among challenges that on a daily basis you look at and have some concerns about?
Well, as a CEO, I have concerns about it because my job is to keep Dr. Hemady making sure he has the resources to carry out what he needs to do to be able to provide care. So there's going to be structural changes with the changes on Medicaid. There will be work requirements. So we as a community are going to have to come together and make sure that there are enough opportunities for individuals to either volunteer, to work, or continue education. That's going to be a requirement in order to get Medicaid. About 60% of our patients are Medicaid or Medicare. So we bill for those services. So with those changes, there's structural changes. And so we're going to have to structurally change that. Will we close? Absolutely not. Will we look a little differently? Absolutely. Will we be looking to foundations and fundraising opportunities? Absolutely. We'll need to do that because we know our population will have difficulty getting in and being able to hold a job down. If I have a mental illness,
Right.
I have a hard time holding a job down. I have a brother who has mental illness, and it's a struggle for him to be able to do day-to-day things. So it will require us to structure and to look differently, but it won't impact our ability to deliver care, who we see for services. It will be more of an impact behind the scenes, and we'll be looking to do more fundraising opportunities and be working with foundations on partnerships and just restructuring differently.
And on the subject of fundraising, you have a first fundraiser coming up, and in part to support the new school the charter school that you recently purchased and will refurbish for your use. Tell me about the September fundraiser.
So I'm excited. This is our first fundraiser. My first fundraiser, Dave. I'm nervous. Is September 27th. It is a gala. It is a Great Gatsby gala. So we'd love it if people would go to our website and purchase a ticket and come out and celebrate both our opportunity as a community to support the Honor Community Health Center and the great work that we're doing. So there's more information on our website, and I would love to have as many community members coming in. It is, again, on September.
Ways, Dr. Hemady, that the community, those interested in supporting the mission, ways that people can do that.
Yeah, I mean, as Deb mentioned, they can we're always welcome individuals to come and stop by to see what we do. I think that for us we are very grateful for what we're doing in the community, but I think if you just stop by and see what we have to offer, what we offer to our patients, I think we would be very appreciative of that, just that gesture.
We'd love it if they spread the name about Honor Community Health Center piece. We're here to serve the community. And so I think more people know about us and can spread the word and say, hey, listen, did you know you can go for care? I'm always surprised when people say, I didn't know about you. And there's truth to that. We're still young. We're one of the youngest community health centers in the state of Michigan. Many have been around for 30, 40 years. We've only been around for 10 years, which sounds like a long time, but when you're delivering care, it's not that long. And so we'd love people to let others know about us. We'd love them to thank our hospital partners, McLaren. We have a strong partnership with McLaren and Trinity and Corewell. I think the opportunity to be able to say thank you is always a great thing to do. But we always welcome donations, and those donations go directly into the care that we deliver. So about 80% of our costs go directly into the delivery of care. So through the employment of our physicians, nurse practitioners, our nurses, the medical supplies, our overhead is very, very small as a nonprofit because it goes into supporting our residents. Woodward, I think, is important to know, which is the new location that we're doing, is really being set up as a teaching health center. We want to teach docs, physicians coming in. That is, I think, one of the unique things that we have. We've not lost any of our physicians in the last 10 years, particularly through COVID. We've maintained the same core, and that's because they're really committed to what we do and who we serve, and they love teaching and being a part of the community.
Well, it's a fantastic mission, and certainly important as well, serving. Maybe, Dr. Hemady, a last word for you in terms of, urging maybe those in the community who need health care to consider Honor Community Health as the place to go.
Yeah. We're here for the community. We are committed to our patients, to our community members. We are here to provide high quality care. And even if we cannot provide that service, we will direct you to the right place. Our commitment is unwavering. Our commitment is to this community and to the communities that surround us. So you could be living in Bloomfield Hills, does not mean that you cannot come to us. Absolutely. We will care for anybody who walks in through our door, and provide high quality care.
Excellent. We appreciate the time today. Thank you for informing us about the mission of Honor Community Health as well. We appreciate your time today. Deb Brinson, the CEO, Dr. Nikhil Hemady, the Chief Medical Officer at Honor Community Health. We invite you to come back next time on the Dave LewAllen Podcast. Again, we cover sports stories, newsmakers, and difference makers in our communities like these two individuals and the organization they represent. Find us on YouTube, Apple Podcasts, Spotify, Amazon Music, wherever you go for your podcast, and spread the word. Share this with friends as well so we can continue to grow and bring you great conversations just like this. Thanks to our producer, director, Josh Bowron. Until next time, stay safe, be kind.